Hey everyone, it's Mariette from the New York City Organization of Public Service Retirees. This is yet another segment of the Michael Mulgrew Visiting Florida RTC Retired Teacher Chapter Meeting, and this is number 10. Now let's go to the videotape.
I understand it and the value of the services you're trying to garner in New York, but going back to the lady's point over here.
Yes.
When Medicare Advantage plan here, doctors, a lot of doctors don't want it, will not do it, will not accept it. Let's roll back a couple of years when this whole thing began, and we were asked to call the doctors and tell them about the plan and ask them to accept it and all that. So in other words, the work from in-house wasn't really done the right way. Doctors knew nothing about anything, and they still don't, and they still won't accept it. So going to her point, all of us at some point are going to be there with a doctor not accepting a Medicare Advantage plan. We're not in New York. We don't have the Advantage of MSK, NYU, Columbia.
We actually made sure for that Medicare Advantage plan that is still not in effect. Okay.
So the interesting thing, Michael, is what you're not saying is the Aetna does still currently have a Medicare Advantage plan that actually is in effect. And it is a slightly different contract number, H5521, but that just gives them the ability under Medicare's rules to administer an employer group waiver plan in the city of New York. And yet, this is Aetna, who's a national company, and their network is their network. They're not going to be taking on massive numbers of providers that don't want anything to do with them. They could make temporary agreements like they did with MSK or HSS for the city of New York. But now, take a look at the state transit program. The state transit Aetna program, they've had Aetna for years. They currently have 2 Aetna Medicare Advantage plans, and yet both of them only joined, had a contract with MSK for 3 years because of our advocacy exposing that the New York City Medicare Advantage plan had MSK in the network and theirs didn't. However, Hospital for Special Surgery is not in their network. Okay. And yet you have hospitals like Mayo Clinics or hospitals and providers in Minnesota, which is mostly a United Healthcare Territory region, not Aetna, is not in their network. And in the Minnesota area, Aetna customer service actually told our retirees, sorry, there's no doctors next to you in 50 miles, but you can go to CVS and use a Minute Clinic. She's absolutely 100% right that there are doctors around the country that will not be in an Aetna Medicare Advantage plan. The Aetna plan that is contract with the city. You had Sabrina, who is one of the city account representatives, state in an MLC meeting, the only thing custom about this plan is that we added MSK and HSS. I could play that audio tape for you if you'd like, Mike. But Medicare Advantage is Medicare Advantage. And Sabrina said it. That is the only thing that's custom for you.
It's not in effect. Those conversations and contracts, especially with the big hospitals around here, were done. Okay,
no, they weren't, because actually we have several affidavits from people like Mayo Clinics or some specialty hospitals, especially for like transplants in the state of Florida, that absolutely refuse to take this plan, including doctors that don't want anything to do with Medicare Advantage, even your Medicare Advantage. And why would you then start to implement a plan that wasn't going to have a complete network? Tell them the truth. The contract that you sign allows the city to have a waiver, allows Aetna to have a waiver in regional coverage. Your network only has to cover 51% of the population of the city of New York's group employer plan. That's it. Now, while they do cover, there's more of us that do live in their region in the coverage area for Aetna's network. Yet that does leave thousands of people without network coverage. And you're not admitting that. Unlike traditional Medicare, where 99% of doctors in America accept the plan. Tell them the truth.
dealing with all the doctor issues, but the company that's doing the work gets stopped in court. Now we're jammed up in court. We're not going to implement it if you can't go to your doctor.
And the plan, it's the plan that wasn't being implemented. Are you saying, though, that the network was constantly being fluid? Then you're admitting that the plan wasn't the problem, it's their network that's the issue. And the only way the network was going to improve was by retirees going to seek medical care, running up against a brick wall, having to come to you or the MLC or their former union who doesn't represent them, or the OLR, and probably never be reported back to you, or you will never get those reports back from Aetna, because who hell knows if there's accountability there, that their doctors or hospitals would not be accepting the plan. And then what? Delay until that they end up having to pay out of their own pocket or go someplace else inferior, or where their provider isn't doesn't have a license to administer medical care. So what? That you can pretend to intervene or try to intervene or try to mitigate the issue just to be told, sorry, we're not taking the plan? That's really not right, Mike. That's not how this should go.
Okay? I don't know how many times that's been said to you. It's been written and sent to you, and that's it. I don't know what else to say about it.
Why don't you go national?
No.
Why don't you not call out?
And so, and that's the problem, that you're just not listening to people say to you, they don't want this. In 60 years of healthcare plan in the city of New York, we've always had a choice. Every SPD said, choose the plan that's best for you. Even your own UFT documents say when you're Medicare eligible, you will have Medicare and a supplement. And yet you chose to strip that away from everybody so that you could use the value of our healthcare to pay for in-service workers' health premiums, knowing that in-service workers make way more money than we do, and you breached the union promise that was made to us by our union leaders, by our city of New York leaders. You took something that belonged to a retired unionist, and that is criminal. That you were okay with stealing from a retired union worker a healthcare benefit that they need at the most vulnerable time of their life. Michael, really, find your way, brother, because this is not the union way. This is video 10.